The most common knee abnormalities that you are likely to observe are bow legs, knocked knees, and hyperextended knees. As the name suggests in bow legs, the legs are bowed out. And due to the way they stand, people with bow legs are likely to experience medial knee pain due to the wear and tear on this aspect of the joint. Knocked knees is when the gap between the knees is small and they experience a knocking of the two together. An individual with knocked knees is likely to experience patellofemoral joint pain due to the compromised position of the patella. These two abnormalities will be seen from the anterior view. In an ideal posture, the patella should line up with the second toe. It is important to note that these two abnormalities are frontal plane abnormalities and are isolated to the knees. These should not be confused with excessive medial or lateral rotation of the leg, which actually occurs at the hip joint. The most common knee abnormality that you are likely to encounter is the hyperextended knee, and this will be seen in the lateral view. In this position, the knee curves posteriorly and the tibia angles slightly backwards. This position creates a lot of knee instability and promotes extra stress on the deep ligaments of the joint. Hyperextended knees are often associated with excessive anterior tilt of the pelvis and is quite prevalent in those who wear high heels. As mentioned before, a knocked knee or a bow knee should not be mistaken for an excessive medial or lateral rotation of the leg. Medial and lateral rotation indicates that the femur is rotated inwardly or outwardly respectively, and you can observe this from the anterior view. Either way, excessive rotation means that the leg is not optimally aligned in the hip joint, which, as you know, puts excessive wear and tear on other structures, as well as being in a suboptimal position to transfer force. In observation, medial rotation will present with the anterior thigh facing inwards and with the knee following suit. In lateral rotation, the anterior thigh will look like it's facing more laterally, and again the knee will follow. It is also common to see the feet following the rotation.